he may try to get a new one for that instance. But at the same time, we are trying to promote using the unique ID for each and every visit. But that is why we have a different ID for health. Because the Sri Lankan government is taking action now. As in Cambodia, we also have the ID only for the adults, but the government is taking action now to issue a number for the children also in the future.
Thank you, Manjula. So in Sri Lanka, you get an ID when you become an adult. Is that correct?
Yeah. Yeah, you get an ID when you become an adult. But a system has come up which is there to change that and to give for children also.
Are you also using
near future?
Are you also using a biometric in Sri Lanka?
No, not yet.
Not
because
yet.
We have just not yet. We have finalized the health identification number format, and we are on the technical discussions on the implementation level.
But in Sri Lanka, there is a national agency who's in charge of the identification system.
Well, for the citizens in the country, the Ministry of Population is handling the national identification, but the Ministry of Health is handling the health identification number, which is issued by the Ministry of Health.
Ministry of Health. Okay. Thank you very much, Dr. Sambath. Thank you, Manjula from Sri Lanka. Back to our speaker, Dr. Sambath. You mentioned that you are using URU biometric, but only for 1:1. How does that work? How does that work?
This will include the existing database system from the Ministry of Planning that they collect the information about the poor through the household, and then they will scan all the finger and store in database. When the patient comes to the hospital, we will scan the finger, and they connect. We just confirm that because they already have the idea that we call pre-ID. We just confirm that this is a correct person, like a Mr. A is a Mr. A, not B.
Yeah. So there's when they use their fingerprint, you also have to tell the system what is their number, right? So that they can do a 1:1 match. Yes.
Yeah. Because the one inexpensive, we cannot use it.
Any other questions? I saw some. There's a question here before I went to Manjula. It came from Michael. And he's asking if there's any approach from URC to link existing patient registration systems in the hospitals to other health insurance funds. So right now you have 20,000 IDs in one hospital, right, Dr. Sambath?
Yes.
The linking will be done. Is it in the plan to link all of these hospitals together through some agency like a health insurance fund?
Yes, so because in PMI, we not only track the patient ID from the PMI, we also can enter multiple ID for the patient. If they have the ID from the insurance, we will enter into the system. If they have the ID from the HIV/AIDS program or diabetes program, we will enter all into the system, and then the computer will read and link all the ID together in one.
Well, that's very difficult also for to get all of the IDs from different systems together in one system. Who's orchestrating all of these? The PMI? Who's leading all of the... So, if there are hospitals with different ID systems, who is going to be the overall in charge of making sure that these different ID systems are linked together in Cambodia?
This Ministry of Health, Department of Planning and Information System that under Mr. Sabin who will sit here. And also now we have the technical working group to talk all the patient ID so we can link and harmonize the ID together.
So Mr. Butsaben will be one of the people involved in the linking. Is that right?
Yeah.
Okay. Mr. Butsaben, you have a big job ahead. AeHIN is here to help you whenever you need one. Okay, let's hear it from Manjula. Manjula, why don't you deliver your question directly? Over.
Yeah, my question is that how do you ensure patient anonymity when a patient wishes to be treated anonymous, like in a situation?
Okay, I will repeat the question because Manjula had some echo.
Yeah.
Manjula was asking, how do you ensure patient anonymity
Transmitted diseases,
when the patient
ID, or
wishes
can they go
to be
for a
treated
different ID in
anonymous?
that situation?
Dr. Sambath.
And excellent question, because it's the hard one. But as my presentation that we have the username and password, and the data only share with the provider. So also the encrypt system in the database system. So that's the first step that we do for the privacy.
And later on, Dr. Sambath, when you start linking the databases together, I think the anonymity and the privacy will become a challenge, right?
Yes, yes.
Yes, when it's...
Yes. We will store the database into table, but this will need high technical. Like we put the name different and also the clinical data in a different database system. So also can be the privacy. That we talk more in the future in Cambodia.
Okay. Any other questions? Dr. Sambath, what if there's something AeHIN can help out in the CRVS system in Cambodia, what might that be? What assistance would you ask from the network?
That's a good question. I will talk with the Ministry of Health what kind of the clinical that we can get from AeHIN.
Yeah. So the Ministry of Health in Cambodia can actually tap the AeHIN network through Mark Landry. And if you identify anything that you need, just let Mark Landry know, and the network will try to find a way to help you out.
Yeah, yeah.
Did Mr. Saben hear that?
Yes.
Dr. Sambath? Hi, Dr. Saben.
I give.
Okay. Dr. Saben.
Yeah. Good afternoon.
Well, good afternoon. Welcome.
Yeah.
I was telling Dr. Sambath that in case Cambodia Ministry of Health needs help for the CRVS, they can extend a request through AeHIN, through Mark Landry. Just let us know how we can help, and then we can find a way to help the CRVS activities in Cambodia.
Yeah.
And how many people are helping you out right now, Mr. Butsaben?
Pardon?
How many people are helping you right now with CRVS? I will type my question.
Yeah. I'm not sure because you mean we want to know in our unit or?
Yes, your staff in your unit.
Oh yes, only 9.
9 people. Okay.
Yeah.
Right. You have big work ahead of you, Mr. Saben. We'd like to let you know that in case you need help, just let us know.
Yeah.
There's another question here. The current system right now is focusing on the identification of patients. When you want to manage a healthcare system, then you need to be able to exchange data between hospitals and health insurance. Who will initiate this exchange between hospitals and health insurance, Mr. Saben?
Oh, we have one unit that in charge this one. It's called health financing unit.
That's under the Ministry of Health?
That's in the same department, but we have in our department we have three units. Yeah. So we have the planning and information system and insurance unit. Yeah.
Okay, so there's the planning unit. That's where Mr. Sabet works. Then there's the health financing unit. There's the health financing unit that will take care of the exchange of data between the hospital and the health insurance.
Yeah.
And the third unit, Mr. Saben is
me for health information system. So we in charge of the data.
okay.
Yeah.
All right. Thank you very much.
Yeah.
Any other questions from the audience to our Cambodian resource persons, Dr. Sambath and Mr. Saben? I think we had a very interesting insight into Cambodian and to some extent also the Sri Lankan system. In the Philippines, we have what we call the National Statistics Office. They are in charge of assigning the unique identifier to the patients. However, we have not yet established a way to exchange data between hospitals and health insurance. And I hope that in the future I will be able to present our proposal for electronic claims, which is one of our projects in connecting hospitals and health insurance funds. Last words from Dr. Mian. Go ahead before we shift to our private meeting. Dr. Sambath, any last words from you?
Yes, thank you for all participants and enjoy with my presentation, and welcome any comment and suggestion can send an email to me because we have email in my presentation. We also like to learn more from other countries that we can bring the experience and to improve the implementation patient ID in Cambodia.
Thank you, Dr. Sambath. Ms. Tongsin, I think, I don't know if she has a microphone. Tongsin, can you actually talk or only chat? I think China is the largest country in the Asia eHealth Information Network. So maybe they have some lessons also with civil registration. Okay, I think Tongsin is not able to talk right now. So thank you very much, Dr. Sambath. I'd like to ask everyone to stay for our AeHIN meeting. This is the end of the AeHIN Hour, and we had a presentation from Cambodia on patient ID, civil registration, security, and now we will proceed to our Asia eHealth Information Network agenda. Again, I am Dr. Alvin Marcelo. And last January 14, we had a meeting and we discussed what might be our AeHIN Hour topics for the rest of 2013. We have a list of topics already, and the topics are the topics from Dr. Sambath. He suggested that he would like to have topics on technical information, on data standardization and interoperability. He wants some discussions on SNOMED, CT, and EPOS, and on electronic medical record system. Dr. Mohan from Sri Lanka said that he wanted to hear stories from country experiences on developing a national eHealth strategy, including leadership and governance in the process of coming up with a national eHealth strategy, especially change management. Dr. Mohan from Malaysia also wanted a discussion on how to use evidence for data quality. And last topic for Malaysia is, do you build or do you buy hospital information systems? Because their experience in Malaysia has been, they bought hospital information systems, but they have some challenges as well, and they wanted to share this experience. from Dr. Bunchai of Thailand. The topics he wanted were discussions on WHO handbook on health data standardization and interoperability. He also wanted a discussion on SNOMED. He also wanted a discussion on Open EHR and HL7. From Dr. Marcelo of the Philippines, he wanted a discussion on SNOMED, and he also shared the topic of Dr. Mohan on leadership and governance. From Dr. Phung Kam of Laos, he wanted some discussions on ICD-10 and also assistance and on topics on MDG 1 and 5 and nutrition. He also wanted to have some AeHIN hours on monitoring and evaluation of HIS. During the subsequent discussion, Dr. Bunchai said that he can be a speaker on how they develop the Thai medicine terminology using SNOMED CT. And then Dr. Marcelo said he can share how they use XML for electronic claims. Dr. Mohan can share his knowledge on clinical decision support, research in e-health, and open educational resources. Dr. Phung Kam can share their interventions on reaching MDG and CRBS experience. I hope you can see our list on your screen. Aliyah is sharing it on the screen. And Dr. Sambath can share their experience with CRBS, which is what he was talking about today. Maybe we can hear from Darit, Chanay, Manjula, what topics they may want to have discussed in AeHIN Hour. The AeHIN Hour is an open discussion on e-health topics. So if you have any suggestions, just chat on the window if you want to share your suggested topics, and we will give you the microphone. Chanay, do you have some ideas on topics? Okay, Manjula, we'll chat. Go ahead, Manjula. Just type your topics. Yes, we have a lot of topics. We actually have a commitment from SNOMED that somebody from Copenhagen can give a talk on SNOMED. Will you be interested in the topic too, Manjula, SNOMED? Yeah, a lot of good topics. But you know, we have 26 weeks to fill up. So I think we only have 12 topics right now. So if you want to have anything else discussed, this is the chance. Because what we'll do is once we have a list of topics, we will give this to WHO, and they will try to find the speakers for us during the AeHIN Hour. Okay, from Manjula, SNOMED, and HL7. So let's add more interest in HL7 and SNOMED. Darit, in case you have any topics, this is the chance to tell us what you want. I have a question for, yes, we will share this list, Chanay. For Manjula, I learned that during the tsunami, there was a Sahana project in Sri Lanka, and then there was a doctor that started an electronic medical record. Manjula, do you know the name of that doctor or of that electronic medical record? Dr. Paul, yes. Can you share the full name of Dr. Paul? Manjula? Maybe we can invite him to give a talk to us on how he was able to implement it. Do you know how to contact him? We will contact him, and we will invite him to a discussion. The person who informed us about Dr. Paul was the CEO of SNOMED. Okay, so feel free to share with us any topics that you might want. for now, we will submit these topics to WHO, and we will tell you who will be our speakers for the subsequent AeHIN hours. Our next topic is the Cisco WebEx. As you can see right now, we are using the Cisco WebEx system, and we have obtained permission from WHO that we can use the Cisco WebEx for our own e-health discussions within our own countries. So I have asked Aliyah, our secretariat, to prepare the guidelines on how countries can request the use of the Cisco WebEx. Are the countries in this meeting interested in using the WebEx? I'd like to see some answers in the chat window if you're interested in using the WebEx for your own in-country use. That will really help in convincing WHO that we have enough countries who will want to use WebEx for online meetings. For your information, the Cisco WebEx system can accommodate up to a maximum of 25 attendees. So if you want to use this Cisco WebEx, just let us know right now, and we will tell you and relay to you the mechanics as to how you can use the Cisco WebEx. This is a service of AeHIN to the AeHIN participating countries. Our next topic is the AeHIN role and participation in upcoming events. So we have a few events coming up, especially on April 22 to 24, 2013. There will be an Indonesia Health Informatics Forum. I will be going there together with Dr. Bunchai. If there are other people who wish to participate as a speaker, please do let us know so that we can at least ask WHO if they can support. So this is Semarang, Indonesia, which is 1 hour away from Jakarta, April 22 to 24. Also, we will have, and we are planning to have, a annual General Assembly of AeHIN. We don't have dates yet, but it might be after July, to bring together AeHIN people to talk about topics that have been of interest during the AeHIN hour. Some topics that are already emerging are SNOMED, HL7, other standards, and civil registration and vital statistics. So if you have other topics for the General Assembly that will be on the third quarter of this year, do let us know in the mailing list so that the other people will also see those topics, and we can compile a program for the General Assembly maybe as early as February 3rd week. Yes, Manjula, just send us the topics and we will put it in our list. Our fourth topic for today is AeHIN Implementation Plan and Development. So Mark Landry has come up with a draft implementation plan. Unfortunately, he has not been able to send this to us because he is on travel and he has not yet settled down. But this implementation plan for AeHIN will define our strategic action points and high-level plans, outputs, and time frame, including our collaborating partners like maybe USAID and NORAD, and hopefully, and GIZ, and hopefully by having a clear implementation plan for AeHIN, we will be able to obtain support for each of our countries for our e-health activities. Topic number 5 is the new opportunity for country technical assistance on health information systems and e-health, institutional readiness, change risk management funded by USAID. So the AeHIN Secretariat based in Manila reported that there is a lineup of technical assistance support coming from partners like USAID. Specifically, USAID is conducting an institutional readiness assessment and will need AeHIN assistance in coordinating with ministries and departments of health in the region for assessment. There is also several technical assistance that will come from NORAD and GIZ. So I hope that you are listening and that you can relay this to your principals to look forward and prepare for a call for technical assistance, specifically to help countries in assessing their institutional readiness for e-health. Is there interest from the participants in this meeting right now for technical assistance? May I just see a chat response if the TA is of interest to you? It doesn't matter if you're not the official government representative. For as long as there's an interest, that will we will relay this to the official government representative for e-health. So just type on the HIS, just type on the chat window if you have interest in getting more information about the technical assistance opportunity from USAID. Topic number 6. The Global Observatory for eHealth 2013 survey. As you are all aware, this is a regular survey that WHO conducts on the eHealth status of countries. So there will be another survey for 2013. But this survey this year will take a different approach. It will be shorter and more concise. When we were discussing this 2 weeks ago, Dr. Bunchai suggested that maybe we can allocate an AeHIN hour to discuss the contents of the survey, and we can ask somebody from Geneva to orient the AeHIN countries how the survey looks like and how to fill it up. In 2013 survey, there will now be country reports coming from the AeHIN countries, but there will now be a regional report coming from AeHIN. So I do hope that we can get participation from the AeHIN countries in the GOE, or the Global Observatory for eHealth. Lastly, we should be preparing for our General Assembly. As I mentioned earlier, we will be putting up a survey on what topics you might want discussed in the General Assembly, and also if you have any suggestions for locations and places for the General Assembly. As you well know, the informal start of AeHIN was in Manila in June of 2011, and then the next meeting was December 2011 in Bangkok to talk about formalizing AeHIN, and then in August 7 of 2012 we had the formal launch of AeHIN in Bangkok. So we are open to other places other than Manila and Bangkok for the next General Assembly. We would be interested in finding out which countries would be interested in being the host for the next General Assembly, which will be hopefully in the third quarter of 2013. So we have some topics here. The time frame for GOE survey, Aliyah, what is the time frame? So we don't have signals yet, but it will be around second quarter of 2013. Dr. Sambath. For the focal points, actually, the survey for the GOE goes to the Ministries of Health. So the Ministries of Health will then gather e-health advocates in their country, a multi-sectoral group, and then together they fill up the survey. So what AeHIN can assist in this case is AeHIN can, encourage and suggest to ministries who might be appropriate interested participants in the survey. So that's how AeHIN can support the countries, because AeHIN has a wider network of informal networks interested in e-health in each country. The time frame will be around second quarter, and Dr. Sambath says, I would suggest review prepared plans for next AeHIN. Yes, actually that's what we wanted to hear from Mark Landry as to what is the proposed implementation plan. Right now, the plan that Dr. Bunchay and I have agreed on is to focus on capability building and on the technical assistance. But let's hear also from Mark Landry if they have other ideas. From Dr. Sambath, could you share a list of AeHIN members from Cambodia so we can coordinate here and add more members for survey? Definitely. Right now, I think we have Dr. Saben, Dr. Sambath, Michael, and there, I think Chanay. Chanay, are you in Cambodia? Or okay, good. So I think we have many Cambodians on this call. Very good. Maybe also Simon, Chanay, and then you have instead you have I know there are a lot of NGOs interested in e-health in Cambodia, and AeHIN would be happy to support the Ministry of Health in Cambodia to organize the survey, the conduct of the survey. Yes, MOI, MOH, and LOP would be very good participants there. But also the other NGOs, no? Instead, and then Michael, and then Chanay, these people can also contribute very well in the survey. So I hope AeHIN can be a facilitator in terms of organizing the participation, and then maybe the NCHADs also. So I guess when we fill up the survey during the orientation, AeHIN will emphasize the open approach to filling up the survey so that we can have a wider and a more complete picture of e-health from each country. Yes. Of course, the Ministry of Labor, is that MOL? In the formal sector. We will, what we'll do maybe from AeHIN is we can show each AeHIN country the participants, no? Before we have the orientation for the survey, we can have a listing of who are invited in each country, so that all the other countries can get a sense of who are participating in the survey. I think that helps very much other countries in organizing the survey, the conduct of the survey in their country. How can AeHIN help the CRBS assessment in Cambodia? I think you should, after last trip of WHO and Hub, I think after the WHO and Hub in Cambodia, then we hear from Mark his updates, and then the scientific committee can also meet as to how we can best help Cambodia get to the next level. That's how we should do it, Dr. Sambath. Until we get a report from Mark, we will, and then from you also, and Dr. Saben, it will be very difficult to find the next step. But once we get the reports, then it will be easier for us. We also need to get the Ministry of Health involved very strongly in the request, because that's, I think, what WHO needs also when it needs to release resources. Again, a multi-sectoral approach is the AeHIN mantra. We'd like to encourage the Ministries of Health to look in as many people as possible in the e-health planning, because that is the best way to success. All right. We had an interesting AeHIN Hour, and then we from Cambodia, presented by Dr. Reatanak Sambath. Mr. Butsaben was also there to provide him support, as well as Michael Chanay. We also have participation from Darit, Manjula, and Reiko, and Miss Tong Sing. And I think we had a very good discussion. Glyza on your screen is from Manila. He's my student in the Masters of Science in Health Informatics. After the AeHIN Hour, we had a question and answer portion, and then we proceeded to discussing our meeting agenda. You heard the Cisco WebEx is available for our use upon request for as long as it is related to e-health and it is requested by a member of AeHIN. We will share the list of AeHIN Hour topics. We will share with you the implementation plan by email coming from Mark. We informed you about the availability for country TA for e-health institutional readiness and the AeHIN plan for the Global Observatory for e-health. And we look forward to seeing you in the next AeHIN Hour or the next AeHIN meeting. And I hope that you will be able to join again in that next meeting. For our next AeHIN Hour, please calendar, is February 22. If you can reserve that day, we will appreciate it if you can be there again. And as is our tradition, in the AeHIN Hour, we always end with a picture taking. So if you can show your webcams, ladies and gentlemen, if you can show your webcams, we will get a screenshot of the participants that have webcams, and we will use this to document the participation. Thank you to our guests and participants, Chanay, Michael, Mayan Sambath Reatanak, Mr. Butsaben, Darit, Reiko, and Ms. Tong Sin. We hope to look forward to having you again in the next meeting. I'm passing the microphone to Ms. Aliyah for our additional webcam screenshot. Ms. Aliyah?
Hello, can you open your webcam so we can see your faces? Are we all in? Liza is opening hers. Maybe those from URC, they have cam. I can see Manjula opening, maybe Reiko and Miss Tongshin. Okay. Are we all in? There, I see Chanay and Glyza and Manjula from Sri Lanka. We still wait for Glyza. Her cam is loading. As for Michael's chat a while ago, surely we will include the National Social Security Office. Okay, so are you ready? We still wait for Manjula and the others. Okay, so smile. 1, 2, 3, smile. There. Let me just check if I just got that print screen. Thank you very much for participating to our AeHIN Hour. Hope you have a good day.
Bye. Nakita na screen mo. There.
1, 2, 3.
Smile. Wait, smile. Shift this key. The function.
Function.
1, 2, smile. You're on camera. Thank you very much.
Thank you very much.
Goodbye, AeHIN. See you next week, February 22. Bye, Chane.
Leave the meeting room lang po.